Parietal lift. Nicholas, page 494, EOC, page 136. Learning objectives. Upon completion of this lab session, the student will be able to do the following. Describe the motion of the parietal bones, especially with regards to its relationship with the temporal bones. To list the indications for this technique, and to correctly perform this technique on a patient. The parietal lift appears to place transverse stress on the tentorium cerebelli, balancing the tension from right to left. Diagnosis of parietal dysfunction is performed in a fashion similar to that of frontal bone diagnosis, with the exception of hand placement, which should follow the description of hand placement in the treatment procedure here. The treatment. The physician sits at the head of the table. The patient is supine. Number 1. The physician rests forearms on the table and places the fingertips on the inferior border of each of the two parietals just superior to the squamous temporal suture. Cross the thumbs above, but not in contact with the sagittal suture. Firmly press one thumb against another, i.e., one thumb presses upward as the other resists this motion by pressing downward. Thus, the fingers will approximate and induce internal rotation of the inferior border of the parietal bones. At the same time, lift both hands in a cephalad direction towards the physician until the parietal bones move into external rotation. When balance is achieved, the physician reduces the lifting force and allows the parietals to settle back into the skull. Release the patient's head gently and reassess motion.